So, good afternoon, everyone. My name is Ashley Cruz, and I'm the manager of community engagement here at the Mental Health Foundation. Before we get started, the Mental Health Foundation acknowledges that what we call Alberta is the traditional and ancestral territory of many First Nations, Métis, and Inuit, who for generations have lived on and cared for these lands. Our work takes place on the historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, as well as a portion of the Métis homeland, including regions 1 through 6. Since we're in a virtual environment today, and we know that we have people joining from all over Alberta and even outside of Alberta, we also want to acknowledge that no matter where you're tuning in from, we offer respect and gratitude for the land. We're really looking forward to today's topic, which will explore the difference between everyday mental health concerns and diagnosable mental disorders. By the end of this interactive session, we hope that you'll have learned a little bit more about mental health, including diagnostic criteria, evidence-based treatments, and the types of community resources that are available. So if you enjoyed today's session, please let us know. There will be a short 5-question survey to capture your feedback at the end. We always read every response to ensure we can continue improving these sessions, so please do fill that out. And lastly, before I turn it over to our wonderful presenters, I really want to thank Ellis Dawn, our platinum sponsor for our 2025 Lunch and Learn series. Normally we have a speaker from Ellis Dawn, but they couldn't join us today. So I just want to personally say thank you. We're so grateful for their support because we couldn't do this series without them. They have been the platinum sponsor for the last 2 years now. So both our 2024 and 2025 series were made possible through Ellis Dawn. So thank you, thank you. Now I will introduce our wonderful facilitators for today. So this session is facilitated by Anissa Gill and Kathy Mercier, who are both health promotion facilitators with Recovery Alberta Professional Practice and Education Services in the Edmonton Zone. Anissa is a registered social worker supporting adults and older adults who face mental health and addiction challenges. Anissa is also a sessional instructor at MacEwan University in the social work program. Kathy brings experience in providing community support and psychoeducational materials to children, youth, adults, and families in the areas of mental health and addictions. We're thrilled to have you with us today. You've been with us since the very beginning, since we started these at the end of 2023, actually. So a big thank you to you as well. And I'll pass it over to you now.
Thanks so much, Ashley. I'm going to share screen if I can, but
Yep.
sending you a request, so maybe I'm not a co-host right now. Just
Okay,
double check
then
that, and then we'll try again. I don't know what happened there.
there we go.
Okay,
Zoom had
great.
some updates last night,
Yes,
people, so we're working through it. Thank you.
we're having lots of fun. All right, so we are excited to share all this with you today. We're going to be looking at problem or disorder. We're going to dig deeper on mental health diagnosis, and this session is brought to you by Recovery Alberta in partnership with Mental Health Foundation and Alice Dawn. So thanks for joining us today. Just a disclaimer, today's information is for educational purposes only and shouldn't be used in place of medical advice or instructions or treatment. So of course, any specific questions around your health, the health of people you work with, or a loved one, please contact the doctors or other mental health professionals. For today's session, we're going to look at what mental health is and what it isn't. We're going to look at the Diagnostic Statistical Manual of Mental Disorders. We're going to review some common mental disorders. And we're going to talk a bit about what a diagnosis is, what an assessment might look like, what some treatment might look like, and look at some mental health resources at the end. So before we begin, we're just curious, when you think of mental health, what comes to mind for you? Maybe put your answers in the chat if you don't mind. When you think about mental health, what are the words that come to mind for you? What thoughts do you have around mental health? I'm just going to move that over here. What do you think? Resilience. There you go. Yeah. Kind of being well. We think of resilience. Sure. Any other thoughts come to mind for people when you're thinking about mental health issues, mental wellness, or mental health challenges? We've got depression, suicide coming up here in the chat, well-being, unique experiences, right? Very individualized. Anxiety, taking care of the mind and body. We've got balance coming up here, inner peace. It requires daily work. That's so true. And someone said it's viewed as a negative or something that needs to be overcome, but rather is something that can be part of mental wealth. Very nice. Affects everyone. Everyone has it. We all have mental health. These things are true. Yes. We've got a state of your emotions and your reactions. Absolutely. different from mental illness, right? It can be. If we have mental health, and the flip side might be that mental illness, we might think. Okay. Well, thank you everybody for sharing. Very good point that just came up. Not everyone understands it, right? We have a lot of different feelings, and we often think of mental health as something different than our physical health. So we don't always understand it. So thanks everybody for sharing that. We have lots of different responses of what we think. Mental health can be, and that's how it should be. We have different experiences. We have lots of different knowledge about what mental health is, different observations of what it is in our own lives and the lives of people that we know. And so we're just going to look at what is mental health. And like physical health, it's really important for us to have mental health, to live that life of wellness, that life of purpose. And so we're going to look at a simple definition of mental health. And this comes from the World Health Organization. And they say that mental health is defined as a state of well being in which every individual realizes their own potential, can cope with the normal stressors of life, can work productively and fruitfully, and is able to make a contribution in their community. In other words, mental health is our ability to kind of overcome the challenges that we face in life with resiliency and optimism. When we talk about mental health, we're talking about our mental well being. As just like many have mentioned, it's those emotions we have, our thoughts, our feelings, our ability to solve problems, our social connections, our understanding about the world around us. And sometimes we consider mental health as secondary to physical health, when in reality, all parts of our health are interconnected. We can't separate them. There's just no health without mental health. So we're going to pull up a poll here, I think, if we can do that. And the poll is just true or false. You can have a diagnosed mental disorder, but still have good mental health. Let's pull that up. Oh, we got that here. You can have a diagnosed mental disorder, but still have good mental health. What are your thoughts? They're coming in. Right now, everybody's on the same page here in the poll. I'm just going to end the poll here, I think. Just a few more coming in. Almost everybody's coming up with the same answer here. Okay, now I think we're going to end the poll. And most of you, by far, the vast majority, said that the answer to this is true, and this is correct. Whether or not somebody has a diagnosed mental illness, positive mental health can still be achieved. It's also possible to have no diagnosed mental disorder and still have poor mental health. So just to show you an example of that, mental health falls on kind of a separate continuum than the symptoms of mental illness. So we can have good mental health, but have a diagnosed mental illness. Maybe it isn't managed, maybe there's strategies and treatments that are helpful to it. And so it is possible to have positive mental health with having a diagnosed mental disorder. And it's also possible to have poor mental health without um, mental illness. So I might not be diagnosed with anything, but maybe I'm not doing well. So sometimes we don't understand these things because there's lots of stigma that can be associated with mental health problems. Some people think that those who do have mental health problems are like unmotivated or weak or incapable, but this isn't true. With the right supports, with the right treatments, with the right strategies, all people, including those with a diagnosed mental illness, can live well, can find meaning, can contribute to our communities, can work towards their personal goals. And so here's another helpful way of seeing that relationship between mental health and mental illness. So this diagram shows different interrelated levels of mental health. And at the bottom, we've got no distress. This is the widest category. It's the mental state that hopefully most of us reside in most of the time, or at least a bit every day, where we have no distress. We might, we're in a state where we feel regulated, we feel open, we feel pretty able to take on what the day has in store. And this is a universal experience. We all have times of no distress. Next up the pyramid, we see mental distress. And this is the brain's expected and usual increased response to the stresses of everyday life. We've got work to do, we've got exams, we've got relationship challenges, we've got disappointments in the day, we spill our coffee, we miss the bus. This is also a universal experience. It probably happens to every one of us at some point within our day. And The feeling of mental distress might not always be pleasant, but this type of distress is really essential. It's the type of stress that helps us to get going, to get moving, to get focused, to get motivated, to take action. It's often seen as negative because it doesn't always feel great, but it's really helpful and necessary for adaptation, for learning, problem solving, coping. Everyday stress isn't probably going to need treatment as it's a short term response, and the body's usually able to return to a state of no distress pretty quickly. And then sometimes we face a mental health problem. And this is, again, something we all experience from time to time over the course of our lives. This is the brain's response to a severe or persistent life problem. So we're talking about maybe the death of a loved one, severe bullying, divorce, burnout, job loss, something that can really take a hit to our feelings of wellness. This is also universal. This happens to everyone at a different point in their life for different reasons. With mental health problems, adaptation can be a bit more difficult. And these challenges might still require some attention, some additional time or support to help us through them. So it might be that we have to take a little bit of time off work, or we have to cancel some obligations, or we have to connect with additional supports, bring a few more people around us. We might need to see a counselor or therapist. However, it usually doesn't require formal treatment or long-term support in that way. At the very top of this pyramid, we have mental disorder or mental illness. And this is the smallest category because it's not universal. It doesn't affect everyone. With a mental disorder or illness, the brain is not functioning in a typical way, leading to significant and persistent problems in a person's everyday life. This can be caused by a combination of genetic factors and environmental factors. And again, not everyone's going to receive a mental health diagnosis of an illness in their lifetime. So, mental disorders must be diagnosed and treated by a properly trained health professional using evidence based and scientifically valid assessments and treatments. And so, today, as we talk about having a mental health diagnosis, this is the category we're going to focus on today. But before we do that, let's just watch a little video about having mental health problems or challenges.
In the past, people thought if you had a mental health problem, you would never feel better. You might meet people who still feel this. Maybe you feel this way about yourself. Mental health is just like physical health. Everybody has it and needs to look after it. You have good mental health if you're able to think, feel, and react in the ways that you need and want. You might need support with your mental health if you are finding the way you're thinking, feeling, or reacting is more difficult or even impossible to cope with. This might be because of things that are happening in your life right now. A traumatic event may affect your mental health in a big way too, even years later. We are all different. Everybody experiences a huge variety of feelings, thoughts, and emotions as part of their normal life. But how and when we have them can be really different depending on who we are. Some of us can find these harder to cope with. This can be because of our upbringing and childhood, past experiences, or the things happening in our lives right now. That's why it's important that only you, someone who knows you really well, or someone who is qualified, gets to say when you need help. If your feelings, thoughts, and reactions are getting in the way of how you want to live, if you feel things aren't right, if you feel like you need help, you can ask for it.
All right. And with that, we'll just do another poll here. In any given year, what percentage of Canadians would be experiencing a mental illness? Um, what do you think? Is it 10%, 20%, 35%, or 50%? What are your thoughts? What percentage of Canadians experience mental health illness? So they might receive a diagnosis and need some further treatment. So things are kind of split up evenly across the board here almost. Okay. I'm going to end the poll. Thanks everybody for putting in your thoughts. Of all of these, the answer is 20%. It's estimated that in any given year, 20% of Canadians may be experiencing mental illness, and half the population has faced some level of mental health concern by the time they turn 40. So, mental health is something that, if we're feeling hasn't affected us right now, it's probably affecting someone that we care about. And it is something that is part of our community. But when might a mental health everyday stressor, like daily distress, or a mental health problem, be actually considered a diagnosed mental illness? A mental health problem, something that we all experience at times, tends to be short term and may come and go depending on life circumstances. The severity of a mental health problem is usually mild to moderate. You might feel down or feel anxious, but can still function in some areas of your life or most areas of your life. The impact might show up in your mood or your relationships or certain areas of functioning, but often it's limited. And with some self care or some increased social support or some lifestyle adjustments, a person can start to feel better. On the other hand, with a mental health diagnosis, this involves symptoms that are persistent over a longer period of time, weeks or months or even longer. And the severity is greater with symptoms that affects the thoughts, a person's emotions, and their behaviors in a way that will interfere with daily functioning across most life areas. So in these cases, professional interventions like assessment and treatment are often needed for recovery. And to help guide mental health professionals in making a correct diagnosis of what's going on, a manual was created called the Diagnostic and Statistical Manual of Mental Disorders, which is on its fifth version. It's sometimes referred to as the DSM-5. And the DSM-5 is the primary diagnostic system used in North America. And it's used to identify mental health conditions in individuals. It helps communicate with clients and other professionals the criteria or things that we have to be considering when making a diagnosis. And it informs treatment plans and that people kind of know better what we're dealing with and then can go and consider how a person can be helped. So it is a tool that is recognized and utilized across the mental health professions in Alberta. And though we're introducing you to this today, we want to be clear that this is a manual for trained clinicians, and it's not to be used for self-diagnosis. It has clinical language, and it is meant to be for regulated mental health professionals and uses terms and language that people who are living with mental health challenges or addiction challenges uh, and their families, it's going to use language that they might not be familiar with, or they might not know the full picture of what the meaning is in the manual. They might not find it actually even helpful. That said, your health professional should be able to communicate this information to you about any diagnosis in a way that really um, it respects you and where you're at and reduces some of that medical jargon and or oversimplified labels. And lastly, the DSM-5 is a manual for assessment and guiding a diagnosis for mental disorders, but it doesn't include information or guidelines on how to treat mental disorders. And it contains 20 different groupings of mental disorders that cover definitions of over 450 distinct mental disorders. So there's just no way we'd be able to cover everything in it today. But with that, we are going to look at some of the more common diagnoses with regards to mental health. And keep in mind, we're going to provide brief descriptions of disorders in this presentation. So we encourage you to talk with your trained mental health care professional to obtain more specific, detailed information around your mental health or the mental health of a loved one. And so with that, I'm going to turn things over to Anissa, who's going to look at some of the more common mental health disorders that get diagnosed.
Thank you, Kathy. And as Kathy was mentioning, there's so many disorders that we, you hear about from the media or social media. And of course, we just simply can't go through all of it. We would need multiple courses to get through all that information. But we'll be just reviewing some of those sort of common mental health disorders that we see in our population. So as you can see, the rates of mood disorders and anxiety disorders have actually increased from 2012 to 2022. So within 10 years, you can see the gray bar in 2012 and the purple bar in 2022 has shown a marked increase of diagnosis of major depressive disorder, bipolar disorder, general anxiety disorder, and social phobia. And in Alberta, we see that that 12-month period, that roughly 12% of Albertans live with either a mood disorder or an anxiety disorder. So some numbers to reflect on in regards to mental health of our population, right? So it is serious, it is happening, and it is a public health issue. So first up, we have anxiety disorders. Everyone feels anxious from time to time, and these symptoms are usually brief and manageable. However, when the cognitive and physical and behavioral signs of anxiety become persistent, intense, and start causing significant distress or interfere with a person's ability to work, study, socialize, and complete daily tasks, that anxiety then becomes outside the typical range. So, anxiety disorders are categorized as excessive worry and apprehensive expectations that are occurring more days than not for at least 6 months or more. And it's really associated about with the events or activities such as work or school performance. Anxiety and worry are associated with 3 or more of the following 6 symptoms you'll see on your screen there. And these symptoms have to be persistent for more days than not in the past 6 months. They include feeling restless or feeling keyed up or on edge, easily fatigued, difficulty concentrating or your mind just going blank, irritability, muscle tension, so feeling in the body, sleep disturbances such as difficulty falling or staying asleep, or just having restless and unsatisfying sleep. So, anxiety disorders can significantly affect a person's relationship, ability to do work, and the overall quality of life. So, the types of anxiety disorders include generalized anxiety disorder, social anxiety disorder, panic disorder, phobias, separation anxiety disorder, substance or medication-induced anxiety disorder. Right, so keeping that in mind, and there are additional disorders under anxiety disorders category. We simply just don't have time to go through them, but the ones you see on your screen are the most common diagnosed ones. And so keep in mind, anxiety can become problematic when it is chronic and when our worries or fears begin to feel irrational and when we don't have the necessary skills to cope. This, however, still does not mean that it's an anxiety disorder. We can have problematic anxiety and not have a disorder. An anxiety disorder is more intense, lasts longer, causes impairment or disability, as shared in the previous slide. So, people with anxiety disorders may experience anxiety almost constantly or in sudden intensity, intense bursts that can arise without an obvious cause. And so these feelings can be so uncomfortable, people begin to avoid everyday tasks or situations that might trigger their anxiety. Some individuals also have anxiety attacks that are so overwhelming, they feel paralyzing and just downright frightening. And although they recognize their fears are often irrational or excessive, many people still struggle to control them. So it's common for someone seeking help to say, I know my fears don't make sense, but I can't seem to stop them. Next up, we have bipolar and related and depressive disorders. So this is a group of mental health disorders which is marked by major shifts in a person's emotional experience, resulting in ongoing sadness, emptiness, irritability, or unusually high energy levels, also known as mania or hypomania. So they involve experiencing extended periods of intense joy, deep sorrow, or a mix of both. So some of these disorders may include having lasting feelings of anger and irritability. So expected for your mood to be varied based on circumstances. But for bipolar or depressive disorders to be diagnosed, symptoms must continue for several weeks or longer. And bipolar depressive disorders can influence your actions and interfere with your capacity to handle everyday responsibility, including work, school, and relationships. Of course, there are many types of bipolar and related and depressive disorders, as you can see on the screen, and we simply don't have time to cover all the disorders that you see in those categories. However, we can go through a few. The first is major depressive disorder, which includes symptoms like feeling sad or hopelessness. The condition also can cause difficulty with thinking, memory, eating, and sleeping. And so for a person to receive a diagnosis of major depressive disorder, symptoms must last for at least 2 weeks. We have bipolar disorder, which is a lifelong mood disorder that causes intense shifts in mood, energy levels, thinking patterns, and behavior. There are a couple of types of bipolar disorder, which involve experiencing significant fluctuations in mood, as referred to as hypomania or mania, and depressive episodes. Typically, someone with bipolar 2 disorder can manage day-to-day functioning and have responsibilities due to a less severe form of mania or that intense energy. We also have seasonal affective disorder, which is characterized by mood changes which begin and end when the seasons change. Many people feel down or have the winter blues when the days get shorter, like what we're experiencing right now as we're transitioning from fall to winter, and feel better in the spring when longer daylight hours return. Other people experience depressive symptoms during the spring and summer months, so the opposite of that, known as summer pattern or seasonal affective disorder or summer depression. Summer pattern SAD is less common than the winter one. Then we have psychotic disorders, which are a group of serious mental health disorders that have signs of psychosis. So psychosis is a cluster of symptoms and not illness. Psychosis is sometimes described as losing touch with reality. So what's likely happening during psychosis is that person has disruptions in their thoughts and the way they interpret their thoughts that makes it hard for them to recognize what is real and what isn't. Psychosis is when a person has abnormalities in thoughts and perceptions in any of these ways. First up is delusions, which are fixed false beliefs that a person holds despite clear evidence that they're not true. We then have hallucinations, which are sensory experiences such as seeing, hearing, smelling, tasting, or feeling that seem real to the person, but actually have no external cause or stimuli. We also have disorganized thinking or speech, which are patterns of thoughts that aren't logical, linear, or goal-directed. And lastly, we have disorganized behavior, which are patterns of behavior that are unpredictable or inappropriate. And so some common psychotic disorders include schizophrenia, delusional disorder, drug-induced psychosis, and depression with psychotic features. Of course, there are other psychotic disorders as well, which are not shared on the slide. We then have personality disorders. So personality is the blend of behaviors, thoughts, and emotions that makes each individual distinct. And even with this uniqueness, both healthy personality and personality disorders follow recognizable patterns. So while our personalities help others anticipate how we might react in different situations, someone with a healthy personality can draw on a variety of coping strategies and adjust their responses when faced with stress. A personality disorder is a mental health condition that's characterized by pervasive, long-term patterns of inner experiences and behaviors that differ significantly from cultural norms and expectations. And so these patterns cause significant distress and or impairment in functioning, affecting how a person thinks, feels, relates to others, and how they control their impulses. So these are inflexible behaviors that make it difficult to adapt to situations and can disrupt personal, professional, and social lives. And so the Diagnostic Statistical Manual 5 categorizes them into 3 different clusters. They're cluster A, B, and C. So let's take a look. So the DSM lists 10 personality disorders that are grouped into those 3 clusters, A, B, and C, according to shared characteristics. So each personality disorder has its own signs and symptoms, but there are similarities within each of the 3 clusters. We have cluster A, which is that paranoid personality disorder, schizoid personality disorder, and schizotypical personality disorder. And so individuals with these disorders often have difficulty with social interactions due to excessive distrust, detachment, or unusual thoughts and perceptions. We then have cluster B, which is those impulsive personality disorders, which include borderline personality disorder, narcissistic personality disorder, histrionic personality disorder, and antisocial personality disorder. And they're characterized by having difficulty controlling emotions, fears, and desires and anger. And sometimes they have a lack of empathy and disregard of others. And then lastly, we have cluster C, which includes anxious personality disorders such as obsessive compulsive, dependent personality disorder, and avoidant personality disorders. And they're characterized by experiencing compulsions and excessive anxiety. And so people with personality disorders are at increased risk of self-harm behaviors and suicide. And so they may also have some difficulty getting along with others than people without personality disorders. So personality disorders result in the lack of adaptability and limited range of coping responses and can result in distress for that person. We then have neurodevelopmental disorders. So neurodevelopmental disorders are a group of conditions that affect how the brain develops and functions. So these disorders typically appear early in childhood and can impact a person's ability to learn, communicate, behave, and interact socially. And they're often lifelong conditions, although early diagnosis and intervention can significantly improve outcomes. So common examples of neurodevelopment, gosh, my words all jumbly here. Neurodevelopmental disorders include attention deficit hyperactivity disorder, also known as ADHD, autism spectrum disorder, learning disorders such as dyslexia, and then motor disorders, which includes Tourette's disorder or tic disorder. And so ADHD, if we think about ADHD, it's characterized by difficulties with attention, hyperactivity, impulsiveness, lack of concentration, or even daydreaming, which can affect performance at school and in social settings, and even at work. Autism spectrum disorder affects communication, behavior, and social interaction. And individuals may have unique strengths and challenges. When we think about specific learning disorders, like dyslexia, it can actually impact specific academic skills, such as reading and writing, making it harder for children to keep up with their peers. And so these disorders vary in severity and presentation, and each child may experience different challenges. So understanding neurodevelopmental disorders is essential for parents and educators and healthcare providers to support affected individuals effectively. Again, we haven't shown all the categories under neurodevelopmental disorders, but here are some of them you see on the screen. Again, we can also get those diagnoses outside of childhood. So diagnosis can happen in adulthood. And finally, we have substance use disorder. So this is when someone who keeps using drugs or alcohol, even though it causes problems in their life. So a person has substance use disorder if they show at least 2 out of the 11 signs in 1 year. So the signs are going to come up there. So some people may be aware that their substance use causes problems, but continue to use even when they want to stop, right? So they continue to use even when they want to stop. And they may use more than they intended or in situations where they didn't want to use. So some people may not see their substance use is out of control or that it's causing problems in their life, or maybe even have negative consequences on their health. They're not seeing that impact. However, it may simply be the lack of awareness or insight into the situation. So whether people realize it or not, lack of control is another sign that substance use is a problem. So when a person may have substance use disorder, the signs to look out for are using more than they planned, trying to stop but can't, spending a lot of time using or recovering, right? Wanting the substance badly, not doing well at school, work, or even at home, right? Having problems or challenges with friends or family, so affecting relationships, giving up fun activities that they used to be involved with, using in dangerous situations where they never used to, right? So it puts them at harm or danger. Using even when it makes them sick, right? They continue to use despite the consequences, such as sickness or those health consequences. Needing more needing more to feel the same effects. So their use, their tolerance decreases, so they require more and more to get the same sort of high. And then feeling very sick when they stop. Again, it really differs on each substance that's being used or if there's polysubstances, but these are some of the signs to look towards if there's a substance use disorder. Each person is very different and unique in how they react to the substance that they're using, but again, keeping in mind that it is a problematic pattern of substance use and can lead to significant impairment. And again, having at least 2 out of the 11 criteria you see on the screen in a 12-month period. So mental health professionals use these signs to figure out how serious the problem is, whether it's mild, moderate, or severe. So this helps them decide treatment options to help the person feel better and have a journey to recovery. And sort of common pitfall that is used is that term addictive personality. It has little scientific evidence to back it. So we really want to refrain from using the term addictive personality because the research isn't there to connect personality to substance use disorder. And so what are the causes of mental health disorders? Well, it's tough to say as there's no one cause of mental health disorders. So research shows there are many different factors that may contribute to the development of a mental health disorder. And these can include genetics. So you may inherit genes that increase your risk of certain mental health conditions. However, these genes doesn't guarantee that you'll develop that disorder, right? So you may have a propensity toward it, but doesn't mean that you will have that disorder. Brain chemistry and function. So your brain uses chemicals called neurotransmitters to help control your mood and behavior. So when we have disruptions in these chemicals and how they work can often lead to mental disorders. And then lastly, we have life experiences and environment. So stressful experiences like trauma, abuse, or neglect, especially early in life, what we call adverse childhood experiences, may increase your risk of developing a mental health disorder. Also, factors like substance use, availability of social support, and chronic medical conditions may also play a role. Again, there's no one cause that can lead to mental health disorders. It's just a combination or variety of those factors that you see on the screen. So with that, we're briefly going to take a look at assessment, diagnosis, treatment, and the recovery process of when a person receives a mental health diagnosis. So a question for everybody here. What are some of the benefits of receiving a formal diagnosis? What are something that you can think of, the benefits of receiving a formal diagnosis? Feel free to share in the chat. I'm curious at what that looks like. Oops. Yeah, you have treatment options, absolutely. Yeah, you may get some additional support at work or at school, right? So when a diagnosis is made, your doctor can say, well, this person needs additional supports. Yeah. Somebody mentioned just having access to proper treatment, right? So once a diagnosis is made, then that, intervention can be provided. Yeah. Ability to use certain drugs to help, absolutely. So medication, access to medication when a diagnosis is given. It helps you begin a recovery journey. I love that, right? So the diagnosis is the first step to getting well. Right. And somebody mentioned having a deeper understanding, right? So once a diagnosis is made, it provides a bit of that relief to say, hey, I finally know what it is. I have a term, I have a word, I can maybe research it on my end. Right. Understanding your feelings if something is wrong, but don't know why, right? So yeah, something doesn't feel right. I've been struggling. My brain doesn't work. But now I have that diagnosis, and now I can look at what treatment options are available to me. Absolutely providing education, right? So the education piece. So not only are you getting that diagnosis, but then you get that psychoeducation piece that's tailed along with it. And so, yeah, you know what you're dealing with versus trying to figure out what's wrong. Yes, right? It's just getting that clarity. For some people, they may have years and years of living with a mental illness, but not knowing what it is and seeing how it impacts a lot of their life. Once that diagnosis is made, it gives that bit of relief and maybe a bit of that peace as to what can I do to move on. Oh, and somebody said it's not just me, right? So you're not alone with this diagnosis. So a bit of that validation to say, hey, what I'm feeling, what I'm thinking, what my behaviors are, right, is rooted in something. And I know I'm not alone. All right. So thank you, everybody, for sharing, right? There's so many benefits of receiving that diagnosis, right? The sense of relief, access to services, validation, getting having a greater framework of understanding, and maybe some of that self-management piece can come in. Right? And you can maybe even share some of that information with the loved ones in your life if you feel safe to do so. Right? The key really here is getting that formal diagnosis helps open a lot of doors for you. So to make an accurate diagnosis, clinicians gather information and make decisions in many different ways, such as doing a clinical interview with a patient or a client to learn about the different symptoms, their patterns, duration, onset, and triggers. So observations of what they see of the client, everything from hygiene to speech to behaviors. Gathering personal and family history as well can provide a full clinical picture. Using standardized screening and assessment tools. Using diagnostics tools like the DSM-5 that we talked about in a few slides before. Gathering collateral information, which is simply getting input from others such as parents, caregivers, teachers, partners, friends, and workers. We also want to explore medical history. So maybe there's some medical information that might be impacting what you're going through. We also want to consider a patient or client's cultural and life context, right? That is also key as well. Again, it gives that full picture. Right, we also want to draw upon our own training and experience in using clinical judgment and any new information or changes that can come up through the ongoing interview, right? So again, there's so many pieces that we collect in terms of getting the right diagnosis. And so with all this, you can see that making a diagnosis is not a one-time event, right? It's an individualized process and it can change. It's just getting that snapshot. And mental health diagnoses are complex because symptoms often overlap with other conditions, right? Including physical health issues. And we want to be really sure that we're not making self-diagnosis, which can be risky. And again, clinicians rely on those interviews, questionnaires, and input, maybe even looking at childhood history, right? And we want to keep in mind the more information we get, the better the clinical picture is for us. So for example, bipolar disorder may be diagnosed as depression if manic episodes are missed. And anxiety symptoms can maybe even resemble ADHD. We also want to think about physical health problems or medication side effects, which also mimic mental health symptoms, adding to the challenge. And so using screening tools like the PHQ-9 or the GAD-7 for anxiety, so generalized anxiety disorder, can help guide assessment, but they're not foolproof. And misdiagnosis can lead to ineffective or harmful treatments, such as antidepressants triggering mania in bipolar disorder, or delayed care causing ongoing distress. Okay, so one thing to keep in mind is we want individuals to track symptoms, such as writing them down in a journal and asking questions and seeking alternative options, and consider doing physical medical checkups as part of their care. And so mental health diagnoses are, again, very complex in nature, and we want to ensure that different concerns have similar symptoms, right? So we really want to do that differential diagnosis. And of course, if information is not there, then a misdiagnosis can happen. But if that happens, you go back to your physician or the person who didn't make that diagnosis, right? So it's an ongoing process, it's an ongoing dialogue between you and your care provider, right? To say this treatment is not working, or certain pieces of information were missed or not provided, right? So it's an ongoing dialogue. And again, we really would encourage you to track those symptoms, right? So have a journal or even a phone app to record symptoms or patterns. And so writing them down can really, again, have that information that you need when questions are asked. Ask questions of providers about their assessment and treatment choices. So you have a right to ask what's happening, right, in that moment. Why are you asking that question? Is this something that's important? And as symptoms change or new treatments are also tried. So follow up regularly so changes or progress can be noted, right? So keep note and track your own diagnosis when it does happen. So, what do you see some of the drawbacks of today's potential consequences or drawbacks on relying on online information or personal assumptions instead of seeking professional help regarding mental health, right? Because we are connected to information more than now before. And so what are the consequences if we do so? Yeah, somebody said misdiagnosis, right? So yes, there's a ton of information out there on TikTok and YouTube and websites. And so we can just diagnose ourselves. Yes, Dr. Google is not an expert despite what you read. Absolutely, right? Dr. Google is available just on our fingertips on our phone, right? You're plugging in all this information to Google and it can give some misinformation, right? Or false information. Yeah, somebody said, we often self-diagnose that we're worse off than we really are. Absolutely, right? So we have this doom and gloom thinking process around what we're struggling with. And somebody says, don't believe everything you read. Absolutely, right? More than ever before, right? We're not regulating that information on the internet or online or through social media. So we have to be very discerning and careful of what information we're taking in. Too many buzzwords. Absolutely. We love buzzwords. They catch on. Hashtag this and hashtag that. But we want to be careful, right? What's sort of the latest sort of mental health, popular concept or terms are out there. So being very mindful of that. Yes. And so, yeah, somebody mentioned AI hallucinations, right? So we have artificial intelligence like ChatGPT or Microsoft Copilot that are, again, available. If I had this conversation a year or 2 years ago, we wouldn't be thinking about it. And now we have. And people are relying on AI not only to get diagnosis, but to get an assessment and treatment. So we have to be very careful as to how this is affecting our life, and particularly around mental health. Yes, absolutely. Wrong info around self-diagnosis. So thank you, everyone. As you can see on the screen, there's a whole range of consequences and risks when we are seeking information online, right? Or those personal assumptions that can come through when we're not seeking professional help. So keeping that in mind. And it may heighten some of those worries, right? Or exacerbate some of those symptoms. And so social media has become a powerful tool for raising awareness about mental health, and many people find supportive mental health communities online, absolutely, but it also presents challenges, particularly around self-diagnosis. So a growing trend has mental health professionals concerned, myself included, as many individuals are turning to platforms like TikTok or Instagram to identify their own mental health conditions. And so videos tagged with hashtags like ADHD and anxiety often feature content creators discussing symptoms they believe they're experiencing despite lacking in formal training or credentials. So, with millions of views of these hashtags, viewers begin to relate to the symptoms and self diagnose conditions such as ADHD, anxiety, or even borderline personality disorder, or even diagnosing other people in your life to say, oh, they have narcissistic personality disorder. We have to be very careful. And so, misdiagnosing a mental health condition, especially based on online content, can be a slippery slope. And so, sometimes even leading to self harm if someone believes they have a condition which they don't have. And so content from reputable sources, such as animated educational videos, such as from PsychHub, to help clarify the risks of these trends by emphasizing the importance of professional evaluation and offering strategies for healthier social media use. Right. And so these resources are available and are valuable for promoting informed mental health conversation and reducing the spread of misinformation online. Right. So experts strongly recommend following up with a medical professional to validate and guide any self-discovered insights. And again, online resources and social media can be helpful, but they should be a complement and not replace any professional advice. Okay. And so that means undergoing a mental health assessment. So a mental health assessment is a structured process used by healthcare professionals to evaluate your emotional, psychological, and behavioral health. It typically involves a combination of interviews, questionnaires, observations to gather information about current symptoms and personal history and functioning. The purpose of an assessment is to identify any mental health conditions, understand that impact it has on your life, and then determine the most appropriate treatment options. So assessments can be conducted in a variety of settings, including clinics, hospitals, community health centers, and maybe even your home. Right? So the step is foundational in creating a personalized care plan that supports your recovery and well-being. So what happens during a mental health assessment? While the assessment is typically conversational in nature and non-judgmental, it's designed to make you feel comfortable and heard. So an assessment, again, can occur in a physician's office, the emergency department, in your home, in community settings, anywhere that there's confidentiality in place. So privacy and confidentiality has to be there when assessment is completed. The information is gathered, which will be, again, help formulate a diagnosis and guide a treatment plan. So it's important to be honest and open during this process to ensure that the most accurate and helpful outcomes are happening. However, the process of an assessment can be very overwhelming. So a person may experience a wide range of emotions and reactions depending on their personal circumstances, the settings, and how the assessment is conducted. So feelings of anxiety or nervousness can show up due to being judged or misunderstood. And these feelings may show up as fidgeting and shaking, difficulty concentrating, maybe having your head down, some of those nonverbal cues. It's also a time when a person may feel the most vulnerable or confused, as there are a lot of personal questions being asked. And lastly, a feeling of relief can happen as well. Finally, having a space to talk openly and being heard can be a huge relief for some. So a person may show this through emotional release, such as crying or laughing, maybe a sense of openness or even gratitude. And as a reminder, all feelings and responses are valid during a mental health assessment. After the assessment, your mental health provider will help and work with you to create a treatment plan. So this could include talk therapy, using therapeutic modalities such as cognitive behavioral therapy, narrative therapy, dialectical behavioral therapy, acceptance and change therapy, and other modalities. Your provider can prescribe your appropriate medications that can help improve symptoms associated with diagnosis, such as antidepressants or stimulants or anti-anxiety medication. Support groups or programs like psychoeducational groups that combines education and group counseling to teach participants on coping strategies and skills to manage their diagnosis. And lastly, lifestyle changes, right? Like exercise, sleep, and nutrition. In addition, schedule follow-up appointments to check in to see how you or your loved one is doing, right? So it's not just a one-off assessment. You want to see a follow-up to see if those treatments are working for you and if things need to be adjusted. And so these visits help, help your care team adjust that treatment if needed, and medication change, again, if that's needed, and if talk therapy is not working or working, to see, again, and what works for you, right? It's tailored to your needs, and have that conversation. Don't be afraid, right? Share your concerns. So assessment and treatments may involve a variety of professionals depending on your needs: psychiatrists, medical doctors, psychologists who focus on therapy and psychological testing, social workers and counselors provide support therapy. In some cases, we get nurses and OTs and peer support workers, maybe even your pharmacist, right, who's involved with medication management and education. Again, each professional brings a unique perspective and skill set to help you manage your mental health. Again, we're wanting to collaborate together to ensure a comprehensive and holistic approach is needed to provide you with the care that you need for your wellness or recovery journey. And of course, before we seek formal treatment, it's so important that we extend compassion more than judgment when having conversations around mental health. Recognize that someone else's relationship with mental health may not be the same as your own, but that might not make it problematic. So let's enter into those discussions without judgment, with a desire to learn more about the other person. Let's be open to comments and observations of our mental wellness and the people we love. We can ask questions, stay curious about how, and if we have any concerns, we can share that what we see or things I've noticed you've been feeling a bit more sad. And then again, in a more thoughtful, deliberate, kind way. Again, to foster connection and collaboration instead of confrontation. So regardless of what our mental health diagnosis is, may or may not, we can ensure personal well-being is part of it. So it helps reduce stress, lowers your risk of illness, boosts your energy. Even small habits can make meaningful difference, right? So move regularly, walking, chatting with people you like. Again, it doesn't matter if you have a diagnosis or not. Those are components that ensure a mental well-being. Right? We want to eat healthy, drink enough water, right? Ensure those basic needs are met, right? Prioritizing sleep too. So as a reminder, mental health is health. Reach out for professional help from your family doctor or therapist for additional support. There are trained professionals who want to assess and support you with any mental health concern. The key here is to take that first step to your mental health recovery, and remember, you're not alone. So some tools you can see on your screen there. We encourage you to take a look, right? They've been helpful, they've been vetted. People use them, right? They're available to you, and they're quite accessible at any time of the day. And so we're pretty lucky to have these tools at this time in our life because they're so accessible. If it was 20 years ago, we might have had a bit of a struggle. Again, really the access to good resources to help you with your mental health is there. And so we have some pretty cool Alberta-based mental health online educations and supports. So some that you can see on the screen there. There's some tips and resources for better mental health. If you Google Wellness Exchange Recovery Alberta, there's some programs and services, Recovery Alberta, and services and programs. I'm part of the CYF education caregiver education in Recovery Alberta, so Google that. There's community education services. And again, these are sort of online resources that are available. Some of them actually offer webinars and workshops that you can look into. So just as a reset, as a reminder, I can pause, I can breathe, this moment shall pass. Relax your shoulders, unclench your jaw, take a deep breath in and out. Right? Just a reminder, at any place you are at, you can do this as a reset. Thank you, everybody. As you can see, there's some more information around addiction and mental health resources in the area. Please contact one of the provincial or national helplines you see here. All the best to you and your families on your journey to better mental health. Thank you, everyone.
Thank you so much, Anissa and Kathy. That was packed with information. I know we flew through all the resources at the end, so we'll make sure that's included with the replays that you can watch, and we'll link them and all that stuff. We do have from Elliston Christie with us to say a few words. I know we're right at time, so those that need to leave, thank you for joining us. But I will bring on Christie here if she wants to close us out. There we go. And I'm going to paste some links in the chat as well for you all. But over to you, Christy, if you're ready.
Hi, Ashley. Yeah, thanks everyone. Thanks, Anissa. Thanks, Kathy, for a very great hour well spent. Elliston is a very proud sponsor of the Mental Health Foundation's Lunch and Learn series. I did intend on opening up the session, but just a couple notes as a little bit of a shameless plug for Elliston right now. So Elliston's a company that doesn't just talk about supporting health. We really do take the time to care for and educate our people. We might be a construction company, but mental health is a pillar of our culture. And through events like today, we can all become a little bit more educated on mental health and look to ensure that the people around us are continuing to find healthy gratification while we work. So again, thank you to the Mental Health Foundation for organizing events like today, and looking forward to the next one.
Thank you so much, Christy and Elliston, and our wonderful facilitators and everybody for attending today. Again, you will receive the replay probably on Monday, and we hope everyone enjoys the rest of their Friday and weekend. Take care.